Opioids killed more than 7,000 people in Canada last year. That's about 20 a day, a significant number. But the death rate was nearly a fifth lower than in 2023. So what's behind this decrease? The CBC's Mark Carcassol has been looking into this for us, and he joins us now. So what more did we learn today from health officials?
Yeah, Hillary, the numbers come from the Public Health Agency of Canada, and in a report released today and a technical briefing that they did earlier in the day, the Canadian Centre on Substance Use and Addiction sort of parses through the report and gives their take on it. And while they say, yes, the numbers are positive, there's something to be optimistic about, they're not getting too optimistic. They're throwing some caution into that optimism. A big part of that is the fact that while the numbers in 2024 compared to 2023 are lower, they are still nowhere near as low as they were in 2019. So they say there's a lot of work for us to do here in Canada on this file. Now let's take a look at the actual numbers on a graph here, breaking them down province by province. You can see that the amount of deaths are significantly higher in certain parts over others. British Columbia, Ontario, Alberta showing higher numbers. 7,146 apparent opioid toxicity deaths in 2024 compared to 2023, down, yes, 17%. Mostly males, about 71% of them aged 30 to 39 make up those opioid-related deaths. And when we look at the areas that had the highest amount of decreases, those would be the following three provinces. Number one, Alberta saw 689 fewer opioid-related deaths in 24 over 23. Then Ontario with 407 fewer deaths. Then BC with 317 fewer deaths. Now, Radia Malam with the Canadian Centre on Substance Use and Addiction says, again, yes, these numbers are good, but there's not a ton of reason to celebrate here. There's still a lot of work that needs to be done.
We know that this decrease isn't seen in every region. There's some regions that are actually seeing an increase as well. And while these numbers are encouraging, the number of deaths are still really high, and preventable deaths continue to occur as well. So those are the two main things that I would say as like a caveat, which would be those two things, that there's regional differences even within a community and within provinces as well.
Now, as far as the drivers for these numbers go, the Centre on Substance Use and Addiction report lists a few, mainly a change in drug supply, changes in how people use drugs, changes in the number of people using drugs, and expanded services and supports. Although they do note with those services and supports, safe injection sites are a big part of that. And in provinces like Ontario, those are being shut down. So we'll see in next year's numbers the effect of that. They also talk about some trends that they're seeing in 2025 that are concerning, mainly an increase in drug toxicity deaths in certain provinces and an increase in the use of stimulant drugs, which bring a whole set of problems of their own, Hillary. So again, next year's numbers will really be a telltale set of numbers to see how far these ones are going in terms of a lasting change
on an issue that impacts so many people and their families. Okay, Mark, thank you for this. CBC's Mark Carcassol. For more analysis, let's bring in DJ Larkin, the Executive Director of the Canadian Drug Policy Coalition and an adjunct professor at the Faculty of Health Sciences at Simon Fraser University. Welcome, DJ, and thank you for being here.
Thank you for having me.
I'm hoping that we can start here with your reaction to these latest numbers that we were just hearing a moment ago from Mark, showing a 17% drop in opioid toxicity deaths. That is between 2023 and 2024. Are you surprised by those numbers?
I can't say I'm surprised, but that's because the factors that feed into the number of people who are dying are really unknown. So every time we see a decrease, we take a breath and say, I hope that means that a loved one is safer. But we also know that that doesn't mean people aren't being harmed by non-fatal drug interactions. And we also know that we've lost way too many people. These deaths are preventable. So a decrease doesn't mean that we aren't going to memorials every month.
What do you see as the main reason or the main reasons behind this recent decline?
So again, there's a number of factors, and I think the report released today identifies them well. But there is a keystone factor, and it's pointed to in this report. It is the changes in the drug supply itself. Under Canadian law, we don't control the ingredients and potency of the drugs. That means that they change over time and they change regionally. Until we get control of that, we're going to see fluctuations up and down in terms of overdoses, harms, hospital visits, and deaths. It is the only factor in the report where we have really good evidence over a long period of time to indicate that that is a primary factor. The other factors identified are relevant, but we don't have sufficient evidence to indicate what the role that they play. The only thing we know is that the drug supply is changing and that government policy could actually be making that worse.
You mentioned there, of course, the differences among some of these regions, and that is something that was highlighted as well in this report. So some provinces like BC and Alberta, they are seeing declines, but then you have places like Quebec and Newfoundland and Labrador that are seeing increases. So what do you think accounts for some of those stark differences?
It could be any number of factors. Like I said, you can have hyper-regional changes in the supply, really hot spots in terms of potent supply that can change numbers quite drastically. We may also be seeing lags in coroner data or toxicity assessments in terms of cause of death investigations. So there's a number of reasons why we might either be seeing decreases or a lag in data. We don't have good, consistent national data to indicate whether health services, health interventions, or other factors are actually playing a role in places like Alberta and BC.
And just to sort of linger on one particular place here, Thunder Bay. Thunder Bay continues to have one of the highest opioid-related death rates in the country. Is there anything in particular, and I take what you're saying here, that it can be very difficult to know, but is there something in particular that you think would make a place like Thunder Bay so vulnerable?
Well, Ontario has made decisions to close supervised consumption services, including in Thunder Bay, which means that there's no place for people to safely go to use where they can be medically monitored, get emergency medical intervention. Also, supervised consumption services are places where people go to get their drugs checked. Thunder Bay is a major hub in Northern Ontario, so there's a lot of people who are going there for other services, whether it's health or social services, and shutting down an essential service like supervised consumption really means that they've closed the door on basic emergency response, a safe place to go, a way to get your drugs checked, and that is going to continue to cause damage in places like Thunder Bay.
I'm wondering, DJ, if we can get your thoughts here on something that my colleague Mark has been talking about as he's been bringing us these numbers throughout the day, and that is this feeling or this thought that perhaps one of the reasons that these numbers are going down is sort of a heartbreaking thought, really, that it's because people are dying, and that then you're then seeing a decrease there. So can you talk to us a little bit about that?
I mean, this is something that in community people have talked about over the past several years, and it is something that's noted in today's report. But that is a tragedy. I mean, that is a sign of government lack of care, borderline negligence. To say that we're seeing a decline because simply too many of our loved ones have died is utterly unacceptable. The report is very clear. It is the changes in the supply that are a keystone factor, and government policy to increase border security, increase scheduling, so making certain substances illegal, actually can increase the volatility of the supply. Those are the things we can fix. We should not be looking at this and saying, well, at least the numbers have gone down because we've lost so many friends and loved ones, but it's certainly something that people worry about every single day.
You just pointed out a couple things that you would like to see or think could be done to try and improve the situation. Is there anything else here, finally, that you would point to as something that can be done so that we do see these numbers continue to decline, but in a more sustainable sort of way?
So we need to bring together a number of factors. We're building an arch. So we need to address social factors like housing and homelessness, pain management, trauma. We need to have treatment services available across a spectrum of types of services. But then again, at the top, that keystone factor is for people who are already using illegal drugs and who are at risk because they don't know the ingredients. We need to very rapidly find alternatives for those folks, because if we at least know what's in the substance, we can better protect health and safety and better find pathways of wellness for people. We can do that through compassion clubs. We can do that through doctor-patient relationships, but we have to do it quickly.
Okay, we are going to leave it there for today, but certainly a conversation that will continue. DJ, thank you for this. We do appreciate your time today.
Thank you.
The executive director of the Canadian Drug Policy Coalition, DJ Larkin.